Hello, Tulsi.
Yes, ma'am.
Kindly make me host.
Yes, ma'am.
You can do it later also. After introducing me, I'll share my PPT.
Okay, ma'am.
Mm.
Kiran?
ಏನು ನೀನೇ ಕಲ್ತೀಯ
Namaste, ma'am. We'll start the session now. There'll be less than 10 participants in Google Meet, and the rest of them will be watching on YouTube Live, ma'am.
Tulsi, 1 minute. I think Manjula ma'am has to join.
Are we waiting for her also now?
Yes.
Okay.
Just a minute. I think both
Okay.
of them will join, and once Anjana ma'am completes, then Manjula ma'am will join in. We'll start the PPT.
Okay. Okay, done.
I'm talking. John meeting. Meeting with you.
Anjana ma'am, good evening. Manjula ma'am, good evening, ma'am.
Good evening.
Yes, ma'am. Yes, ma'am. So we'll start with the session, ma'am. Okay. Tulsi ji, please start with the session.
Namaste, everyone. I take the opportunity to introduce our first guest lecturer for the session, Dr. Anjana L. Siddapur, ma'am. She's an associate professor in Department of Agada Tantra Evam Vidhi Vaidyaka in Sanjeevni Ayurvedic Medical College and Hospital in Hubli. She has a teaching experience of over 8 years, and she has won various awards. She has got first rank in PG in in the Department of Agada Tantra. She's got the Best Dissertation Award and Best Paper Presentation Award, to name a few. She has published more than 15 articles in international journals and has attended various workshops in national and international seminars, etc. She has conducted various medical camps in rural areas and has also organized several guest lectures in various occasions. We welcome you, ma'am. I would also like to introduce our second guest lecturer for the session, Dr. Manjula, ma'am. She has she works as an associate professor in the Department of Agada Tantra in Shri Vijay Mantesh Ayurvedic Medical College in ILKAL. She has worked as a principal investigator in RGUH's research project, which is titled A Comparative Clinical Study of Visha Aragvadadi Agada Lepa and Gandhakadya Malahara in Vicharchika. She has published 6 articles and has presented over five papers in national and international levels. She also conducts cosmetic and trichology courses and has Ayur Care range of cosmetics preparations under her partnership. We welcome you, ma'am. Over to Anjana, ma'am, who will start the first part of the session.
Ma'am, your voice is not audible, ma'am. Your speaker must be on.
Is it audible?
Yes, ma'am. Yes, ma'am. You can start with the PPT and session, ma'am.
Okay. Is it okay, Prishad?
The presentation is not seen clearly, ma'am.
Now?
No, it's in one corner of the screen.
Okay. 1 second. Is it fine now?
Yes, ma'am.
Yes, ma'am. Yes, ma'am. You can continue, ma'am.
Yes. A very warm good morning to one and all here. Myself, Dr. Anjana L. Siddapur, Associate Professor from the Department of Agada Tantra Evam Vidhi Vaidyaka, working in Sanjeevni Ayurveda Medical College and Hospital. I have a teaching experience like 9 years and other clinical experience also. These are before going to start my today's presentation, first I would like to congratulate all the Jignasa organizer because they organize different lecture series on exam orientation. Congratulate all of you. And at this outset, I would like to thank our Dr. Padmavati Madam and organizing team for giving opportunity to share my views on this occasion. Thank you one and all. In this presentation, I'm going to cover all these points. That is question paper pattern and how to prepare. What are the different tips for Agada Tantra preparation, and how distribution of theory examination marks comes under each topic, and what is the blueprint of question paper and model question papers, model question paper solving as per the RGHS question paper pattern, summary and conclusion. This is the main question paper pattern what the RGHS or NCSM has been given to Agada Tantra department. That is, it comes under second year BMS examination, and teacher code is AYUG80, and part A and part B. And along with that, we have only one paper, that is paper 1. In that, we are having 100 marks for 3 hours. The distribution of all the question is for compulsory. Okay. In that, we will be having a multiple choice question. We will be having 20 questions. Each questions are 1 mark and total 20 marks. Second, we'll be having a short answer questions, that is SAQs. SAQs will be having 8 questions. Each questions have 5 marks and 40 marks. Total 40 marks will be there. And long answer questions will be having 4 questions from part A and part B. Part A 2 questions and part B will be having 2 questions. Total 4 questions will be there, and total marks is 40 marks. Coming to the how to prepare this examination is, you have a exams on 20th. We are going to consider your commencement of exams from the 18th Feb. Along with that, you left 26 days. Total papers are to be written for you people is 10 papers. Agada Tantra paper is 1 paper. Each paper have 4 to 5 days to prepare yourself with different subjects. For Agada Tantra, you have only 4 to 5 days. You need to prepare as per your schedule. How you need to prepare Agada Tantra only? Before going to write exams, you need to make a timetable. Which are the points you need to cover in this time only? And you need to keep your syllabus along with you, and you need to mark it. And I have this confidence to cover whatever questions comes under this. You need to, okay, and you need to highlight the important points in that. And if it is very, very important for examination, you need to repeatedly study, or you need to do the revision of that particular topic. Last one is you need to solve the question papers. Why? Because if you are solving the model question papers, means you will be having a perfectness in the or during the time of examination. Coming to the during examination or while writing the examination, the presentation is very important. Why? Because already you have been studied lot of things. You don't know how to write the answer for this question like that, okay. And content and knowledge is also very important. If they ask for something question, means if you are writing some other answer, means that is not a valid answer. Why? Because all teachers are expert in their own subjects. They are looking at your answer papers. Kindly all of you write the whatever they asked or real content of that question, okay. And distribution of theory examination, I'm going to deal about part A. Part B is madam is going to deal. Here topic number 1 is concept of Agada Tantra. Here they are going to ask it for 13 marks. In that, MCQs will be there, SAQs will be there, LAQs will be there. For this topic, you need to prepare for all the questions. Okay, I'll give one model questions also here. Next, Visha Chikitsa. This is general principle management of poison. Along with Visha Chikitsa means Chaturvimshati Upakrama also. Here also they are going to ask it for SAQs, LAQs, MCQs. Okay. And Vishakta Ahara Pariksha and Viruddha Ahara. Here you can relax and read it for only MCQs and SAQs. That's it. Okay. Next, Garavisha and Dushivisha. Once again, you need to read it more. Why? Because here all the 3 questions comes like SAQs, LAQs and MCQs. Okay. Next is Visha Upadrava, and this is caused due to exposure to the Visha or poison. Here they may ask only SAQs or MCQs. Okay. And environmental toxicology or Samuhika Visha Prayoga. Here also you need to relax yourself, like you need to read for only 5 marks and MCQs. Okay. And dermatological manifestation of Visha or poison. Same MCQs and SAQs. Coming to the therapeutic utility of Agada yogas. That is also, it may be a Dushi Vishari Agada, Pilvadi Agada, it may be Dashanga Agada, Murvadi Agada, anything. You need to prepare for MCQs and SAQs. No need to read it for long essay. Stavra Visha, that is, it may be plant origin or metallic origin or Kritrima Visha, that is corrosive poisons, etc. Here, those questions can be asked in any form. It may be a long LAQs or SAQs or MCQs. Okay. Next, Jangama Visha. Jangama Visha is also covered by LAQs, SAQs and MCQs. Okay. Coming to the substance abuse, it may comes like a Madhya or Madhathaya or any other substance abuse like LSD, etc. Here also they can ask LAQs, SAQs, MCQs. Okay. Last point is Agada Tantra perceptives on cancers. Means here you need to know what are the carcinogens, carcinogenesis, and what are the different signs and symptoms of chemotherapeutic and radiation immunotherapeutic induced toxicity, and what kind of treatment they are going to adopt in such conditions. That too you need to prepare for the SAQs and MCQs. That's it. Okay, remaining for 15 to 26 points madam is going to cover. In that, there will be a blueprint of the question paper pattern. Okay, what type of or from which point they are going to ask MCQs means, in MCQs 15 questions should be must to know, 3 questions should be desired to know, 2 questions should be nice to know. From all these points, okay, you need to know must to know, desire to know, nice to know MCQs. Okay, first point is concept of Agada Tantra. They may ask anything. Visha Chikitsa, Vishakta Ahara Pariksha, Gara Visha, Dushi Visha, Visha Upadrava, and asphyxial death, dermatological manifestation, therapeutic utility of Agada Yogas, Kritrima Visha, Savara Visha, or metallic poison, Jangama Visha, substance abuse, Agada Tantra perceptives on cancer, Vaidya Sadrat, legal procedure. In legal procedure, actually what the student used to do is, they will read all the legal procedures like for LAQs, but in examination they are not going to ask LAQs on legal procedure. Kindly all of you remember. But they will ask injury also. Okay, next, pregnancy, delivery, abortion, tenetology, environmental toxicology, personal identity, forensic psychiatry, forensic science laboratory, acts and laws, rules and regulations. Last is poisons of plant origin and sexual offenses. By all these 20 points, they may ask must to know, nice to know, and desire to know MCQs. Okay, you need to prepare for MCQs on these topics only. Okay, SAQs can be asked by these points. Okay, first one is Vishakta Ahara Pariksha, Vruddha Ahara, or Visha Upadravas. It may be asked by diseases caused by the different drug-induced toxicity or exposed to Visha, Gara Visha, Dushi Visha also, and Visha Chikitsa, therapeutic utility of Agada Yogas, and dermatological manifestation of Visha. It may be a Paduka Visha or Abharana Visha, Lepa Visha, etc. Kritrima Visha, like a poison by a plant origin or a poison origin, corrosive or etc. Environmental toxicology, Jangama Visha, it may be like Sarpa Visha, Luta Visha, Kita Visha, Alarka Visha, etc. Duties and responsibilities of medical practitioners. Next, environmental toxicology and Agada Tantra perceptives on cancer, substance abuse, asphyxial death, personal identity, injury, pregnancy, delivery, abortion, sexual offenses, and personal identity. Kindly all of you remember that in pregnancy, delivery, abortion, they are going to ask it only what are the medico-legal aspects of pregnancy and delivery. That's it. You should not read for what are the different types of different signs of pregnancy and sign and symptoms of recent and remote delivery. All those things you should not read. Why? Because they asked only medico-legal importance of pregnancy and delivery in your syllabus. Okay, abortion also same, and here you need to know about what are the criminal procedure to induce abortion. Okay, and sexual offenses, personal identity, forensic psychiatry, forensic science laboratory, laws. In that laws, acts, rules and regulations, etc. You need to read it for 5 marks. Okay, LAQs, only 4 points you need to study for LAQ is Visha Chikitsa, that may be asked only 2 questions here. Write the general principle examination of poison along with explain in detail about any other general principle management of poison. It may be a gastric lavage, or it may be a extracorporeal techniques, it may be a unabsorbed poisons, or it may be antidotes and classification, etc. Another question they are going to ask it here by write the Chaturvimshati Upakrama or illustrate the 24 Upakramas and write in detail about Hridayavarna, Agni Karma, Vamana, Virechana, Nasha, like that they will ask. You need to prepare for that. Okay. Second one is Jangama Visha, Garavisha or Doshi Visha. Here also they may ask two questions. Jangama Visha means among various Jangama Visha, they can ask Sarpa Visha or Alarka Visha or Rushika Visha, anything. Okay. How they are going to ask question on this Jangama Visha means Sarpadamsha Prakara, write in detail about Veganusara Lakshana and Chikitsa of Darvikara. It may be Darvikara, it may be Rajimanta, it may be Mandali Sarpa. Okay. Or else they can modify the questions. Write the Sarpa Beda and write in detail about Sarpa Damsha Lakshana and Chikitsa of Darvikara or Rajimanta or Mandali. Sarpa Damsha Lakshana and Sarpa Veganusara Lakshana and Chikitsa is different. Kindly all of you note that. Both are not same. Okay. And coming to the Garavisha and Dushivisha, commonly they will ask by the asking question that define Dushivisha, write its Nidana, Purvarupa, Lakshana and Chikitsa. Along with that, they will ask contemporary relevance or significance in day-to-day life. Okay. Coming to the Kritrima Visha, they can ask by write toxic sign and symptoms and fatal dose, fatal period and treatment, medico-legal importance and post-mortem examination of particular Kritrima Visha or plant origin or metallic origin. It may be Datura, it may be Vatsanaba, it may be Ahipena, it may be corrosive poisons like H2SO4, or it may be like arsenic, etc. Like that they will ask. And another one thing is substance abuse. In that they can ask define or what is Madhya and Madhya Gunas, explain in detail about Madhatyaya and its types and its Chikitsa. Okay, they can ask by these questions. And last one is tenetology. In tenetology also, madam is going to cover on this topic. Next, I am going to start with the model question paper. I have prepared two model question papers only for LAQs and SAQs, and MCQs are there in the last slides. Okay. First model question papers is containing of long essay and short essay. In long essay, there are only 4 questions. That too having part A 2 questions, part B 2 questions. Okay. First, part A questions are enumerate the general principle management of poison. Okay. And write in detail about antidotes and its classification along with examples. For example, you need to know what are the different general principle management of poisoning. For example, you need to know the resuscitation methods and stabilization of the vital functions and removal of the unabsorbed poisons, how we are using the antidotes and removal of the absorbed poisons, symptomatic treatment and secondary infection. You need to brief all these 7 points. Later, you need to explain about the antidotes. Okay, resuscitation means in resuscitation, you need to know about the airway, maintenance of the airway, management of the depression of CNS and maintenance of the breathing and circulation. All these ABCD you must know. And in case of stabilization of vital functions, you need to know about the pulse rate, heart rate, temperature rate, blood pressure, size of pupil, skin, and level of consciousness, That is called as evaluation of the hemodynamic status of the patient along with all these vital functions you need to maintain. Okay. Next, removal of unabsorbed poison means it may be in an inhaled form or injected form, or it may be a contact poisons. In such conditions, you need to know the decontamination through the eye decontamination or skin decontamination or through the gastric lavage, emesis, etc. Okay. And coming to the absorbed poisons, we need to know about the extracorporeal techniques like dialysis, hemoperfusion, etc. You need to know. Okay. Coming to the antidote. Antidote means these are the substances, agents which are counters the or neutralizes the effect of poisons. That you need to write the definition and different classification. For example, it may be a mechanical or it may be a physical antidote, chemical antidote, physiological antidote, or pharmacological antidote, universal antidote, along with different examples. You need to describe the what is exact meaning of mechanical antidote and along with different antidotes. For example, mechanical antidote means one which prevents the absorption of poison into the body through activated charcoal or demulcents, bulky foods, etc. You need to give examples. And chemical antidotes. Chemical antidotes means one which interact with the poison and it is going to change its chemical nature to form a harmless substances. For example, commonly in case of cyanide poisoning, we are going to give a sodium nitrate. Like that, you need to give us so many examples. Okay. Coming to the physiological antidote. Physiological antidote means same as like a antidote definition. One which counteract the effect of poison by producing opposite effect. For example, very simple examples. In case of snake bite poisoning, in case of scorpion bite poisoning, sting poisoning, we are going to give a anti-snake venom, anti-scorpion venom. These things you can remember very soon. Okay. Furthermore, examples are N-acetylcysteine is for paracetamol poisoning. Atropine is for pilocarpine poisoning, and atropine is also antidote for OP poisoning, etc. Like that, you need to write it. For example, in case of universal antidote, in case of universal antidote, there are unknown or suspected or combination of 2 or more poisons will be taken by the person. In such conditions, we don't know what kind of poison they have been consumed. In such conditions, we need to give a charcoal and magnesium and tannic acid. That too in a 2:1:1 portion. Okay. All these things you need to cover it. Okay. Next. This is the first question. Second question is define Agada Tantra and its scopes. Write in detail about Visha Utpatti. Write in detail about Visha, Karmakata, Visha Gunas as per different acharyas. Okay. And Visha Gunas as per different acharyas means you need to write as per Charakacharya, Vagbhatacharya and Shushrutacharya. If somebody knows only one author means they will cut the marks. Okay. That's why you must know the different acharyas definition gunas of Agada Tantra, Visha Gunas. Okay. Coming to the definition, everybody knows that you are going to write it. And we need to know the scopes of Agada Tantra in present scenario. How you are going to apply this Agada Tantra knowledge in your day-to-day life or in day-to-day clinical practice. Okay. Through Dushi Visha, it may be cumulative toxicity or latent poisoning, or it is also called as slow poisoning. Garavisha, by the artificial poisons, Viruddhahara, that is incompatible foods, Madataya, you can treat the Madataya, alcoholism, and you must know the medico-legal importance of alcohol, and you need to know the Anna Pariksha Vidhi, like Annapane, Dantakaste, Tata, Abenge, Avalekane, etc. Okay, and you need to know about the common contact poisonings, that is dermatological manifestation of Visha, that is Paduka Visha, Abharana Visha, Mukhalepa, etc. Vishas can be used in our clinical practice. Next, Janapodo Damsha. That concept can be used by using the Agada yogas. How means to purify the water, air, land, or endemic disorders also. Okay. Last one is adverse drug effect. How these Visha Dravyas are going to cause or produces any side effects on others' body, or whenever they are going to consume or come into contact with the toxic substances or poisonous substances. Okay, and we can use the Agada yogas also in various indications. For example, Bilwadi Agada can be used in a scorpion poison or a snake poison, etc., etc. Dushi Vishari Agada in case of all the allergic condition, Dashanga Agada in Kita Visha, or complication by the cancers, or Visha Upadravas, Chaturvanshati Upakramas in poison Visha conditions, and we can treat the post snake bite ulcer management, Panchashirisha Agada, all those can be used. Okay, and in scope of Agada Tantra, we should know that in Upavisha, Mahavisha, and all metal poisons, we can do the toxicity study, Shodhana study, and pharmacological study, etc. And we can do analytical study like phytochemical, physiochemical studies by different agadas. It may be a herbo-mineral formulation or a polyherbal formulation, other rare formulation which is not used regularly, but it is mentioned in our samhitas, that too in Agada Tantra. We can do analytical study, and we can do survey study, that is prevalence in society. Clinical study also we can do. Effectiveness of panchakarma in cumulative toxicity, that too in Dushivisha or Garavisha or cancer or allergies. In these conditions, we can use panchakarma, and emergency medications like unexplored practice or unexplored formulations can be used as a emergency medications. These are the very important scope of Agada Tantra in day-to-day practice. Okay, and you need to know about the Visha Utpatti also. Already all of you know what is Visha Utpatti. Anyone want to explain the Visha Utpatti? Anyone? As per Charakacharya, it's clearly says about the shloka, Amrutarte samudretu madhyamane suraihi jadne prag amrutotte purusho goradashanaha deepta tejascha hari kesho analekshanaha, etc. Shloka comes like that. You need to know that you in examination, if they ask for write about or describe about Visha Utpatti, means you need to write in a flow chart. For example, in ancient era, during Samudra Mantana, by Devatas and Asuras to obtain Amrita, before production of Amrita, Gora Darshan of Purusha from Samudra has been occurred or observed, and Gora Darshan of Purusha, how he was there? He has Chaturdamsta and Harikesha, Deepta Tejo, Analekshanaha, and by this word become Vishanna at his site. That's why it is called as Visha. How it is Lord Brahma, by this poison, Lord Brahma deposited this poison in or converted into Jangama and Stavara Visha. This is the Visha is originated from Ambu and Pavaka, or it is resembles like a Agni. You need to write it in a flow chart. Okay, and you need to know about the Visha Karmukata. As per Shushrutacharya, they have been clearly explained about the Visha Karmukata. Anyone knows Karmukata? Tatra Raukshad Kopayed Vayu Ushna Pitam Sa Shonitam Matimcha. Like that, the Visha Karmukta has been explained. Visha Guna is different and Visha Karmukta is different. In Visha Guna, Ruksha Guna, what it is going to do? Ruksha is going to vishesh the Vata. Ushna is visheting the Pitta. Like that, you need to explain along with shloka. If you are writing shloka, they will give more marks, means complete marks. If you are going to write only word meaning and guna, means they are going to cut your marks. Okay. Next, Visha Gunas, already all of you know, no need to explain. Next one is Dushi Visha. How Dushi Visha is going to define. Anyone knows what is the shloka of Dushi Visha? Anyone? दूषितं देशकाल अन्न दिवा स्वप्नैर्भीक्षणः यस्मात् दूषयेत् धातुं तस्मात् दूषिविषं स्मृतम्. You need to write this definition and its meaning, and you need to write the nidana. What are the nidanas? Jirnam vishagnaushadi bitam va davagni vata atapa shoshitam va swabhavato va guna viprahinam visham hi dushi visham upaiti वीर्य अल्प भावान निपातयेत कफावृत्त वर्षगणानुबंधी. Here you need to explain all the words of this, okay, and along with another nidana is Dushita Desha, Dushita Kala, Dushita Anna, Diva Swapna. These are the triggering factors or aggravating factors for our diagnosis of Dushi Visha. Okay. And Lakshana you must know. And before going to know about the Lakshana, you need to know about the Samprapti of Dushi Visha also. Okay. In Lakshana of Dushi Visha, you need to know about the Tenardito, Binna Purisho, Varno, Viganda Vairascha, Pipasi, Murchana Vamana, Gadgada Vishanno, Bavecha, Dushodara Lingam, Justam. For if you know another one shloka, big shloka, you can add that also. That is Tataha Karotya, Annamada Avipaka, Arochakaha, Mandala Kota Mohan. As explained by Shushruta in Kalpasthana 2nd chapter, Annamada, Avipaka, all those signs and symptoms will be lakshanas of Dushi Visha. Okay. Here treatment is you need to know about Nidana Parivarjana and Shodhana, Shamana and Dushi Vishari Agada. You need to know about the shloka of treatment of Dushi Visha. That is Dushi Vishartham Susvinnam Murdvam Cha Adhacha Shodhanam Payet Agadham Payet Agad Dushi Vishapaham means in Dushi Visha we need to do the Nidana Parivarjana, later Svedana, Shamanaushadis and Shodhana and Shamanaushadis. In Shamanaushadis we can use Dushi Vishari Agada, Patola Katurohini Adikashaya, Kalyanakagrata, Bilvadi Agada also, depending on the sign and symptoms. By using the yukti of our Vaidyas, we can change the medications also. Coming to the long FAQs, in case of metallic or plant origin poisons, if they ask, write 90s means toxic sign and symptoms of Datura poison, fatal dose, fatal period, treatment, postmortem examination of Datura poisoning. In such conditions, we need to know about 90s. Anyone want to explain the 90s of Datura poisoning? But first one is dryness of mouth or throat, dysphagia, drunken gait, dry and hot skin, dermatitis, dilated pupils, drowsiness, delirium, and lastly, death. Okay, these are the 90s. You must write compulsory. You should not alter the 90s. Okay, later you must know the fatal dose and fatal period. Okay, 100 seeds of that Datura seeds can be causes fatal toxicity to that particular patient, and fatal period within 24 hours. You need to know the treatment. In treatment, you need to know as per Ayurveda and as per contemporary. In contemporary, you need to know if person is suffering from dysphagia, means you need to have a respiratory support like by giving oxygen or stomach wash with the activated charcoal. And if affected to the kidney, then you need to do the dialysis, or temperature is high, means you need to treat with the hydration or cold sponging or IV fluids, etc. If patient is having seizures, means you can use anti-convulsant drugs. And if it is antidote is there, means you can use the antidote also. Like here you can use a physiostigmine 2 mg IV slowly antidote. And as per Ayurveda, they have clearly mentioned about Vamana with Dugdha along with Sharkara you can induce, and Ruttantaka Falabija is used as a antidote as per Ayurveda. Along with that, there are so many antidotes used in Ayurveda. Chincha Patra Swarasa as per Basava Rajiva, etc. Okay, and postmortem examination also you need to write. After consumption of patient, if patient is treated, then also patient is not survived. If death occurred, in such condition, we can found the datura seeds or its fragments in stomach and intestine. That you need to write it. Okay, and esophagus, due to it is irritant poison, organic irritant poison, we may have a congestion by esophagus, stomach, duodenal, other internal organs also. That you need to note it down. And seeds resist the putrefaction for a long term. That you need to write it in a postmortem appearance or examination. Okay, and if any omitting or stomach content is there, the seeds of that datura can be found in that. All these things you can write it. Coming to the SAQs, enlist the ingredient and method of preparation, indication, dosage of Dushi Vishari Agada. Here, first thing you need to know about what shlokas is there for Dushi Vishari Agada. That is Pippalyo Dhamakam Mamsi, that is Jata Mamsi, Lodra Ela Suvarchika, Kutanatam Natam Kustam, Yasti Chandana Gairikam, Dushi Vishari Namna Ayam Cha Anyatrapi Varyate. Means you need to know the shloka, then only you need to write the, or you are going to enlist the ingredient of the Dushi Vishari Agada or other Agadas. Okay. If you want more marks, you need to know about ingredients and its Latin name and useful part. Which part of the drug is going to use to prepare this Agada, that you must be known. And what quantity you are going to use, and what is the Mardana you are using, Bhavana Dravya you are going to use it, that you must be know. Okay. Commonly, you need to know about the method of preparation. That is, all the ingredients you need to take it in a one part, and you need to take in the dried form and make it into fine powder. Then give bhavana with jala or kashaya of the ingredient. If it is clearly mentioned about the bhavana dravya, then use same, or else if it is not mentioned, use the kashaya of the all the ingredients, or jala or godugdha. Okay. Later, you need to prepare a vati. Okay. And you need to know about the how much time you need to do the mardana or give bhavana. Okay. After that, you need to prepare vati, dry it in a sunlight, keep it in an airtight container. Okay. And you need to interpret this Dushi Vishari Agada or Bilwadi Agada, anything. Is this Nirvisha Agada or Dushi Savisha Agada? Why? Because in all these Agadas, no Savisha Agada, means Vatsanaba, any other Visha Dravyas are there? No. That's why it is called as Nirvisha Agada, and it is having a Vata Kapha Shamana Aushadis, and it acts as a Rasayana and Shamana Yoga. Okay. How it is going to use it in the form of Pana. And what kind of Anupana can be used here? Madhu, Dadi, etc. And where it is indicated? It is indicated in all the Dushi Visha condition. Okay, you need to know about in case of Stavara Visha, Dushi Visha is in Dushi Vishari Agada is indicated. In Jangama Visha also Agada Yogas. Okay, there also Nirvisha Agada Yogas indicated. Wherever it is indicated, you need to write it clearly. Okay, next second question is, explain in brief about dermatological manifestation of Visha through Paduka Visha, Abharna Visha, Lakshana and Chikitsa. In case of Paduka Visha, you need to know about the Shloka and Chikitsa. Shopaha Sravatata Swapaha Padayo Spota Janma Cha Bhavanti Visha Justabhyam Padukabhyam Samsheha. Means whenever person is affected with the footwears which is having chemical substances or a toxic substances or a poison, it is going to cause some toxic sign and symptoms, like a person wearing or any new shoes due to presence of chemical substances in that shoes or chappal or etc. That is going to cause inflammation or a discharge or numbness, or it is going to produce the vesicles on the foot, that is spota janma. Okay, same like Abharana Visha also. If you are wearing any artificial jewelry which is containing of lead, cadmium, zinc, etc. In such condition, it is going to produce daha, paka, avadharana. Daha means burning sensation. Paka means it is going to produce ulceration. Avadharana means peeling of the skin is going to occur. Okay, in case here, what kind of treatment we need to do is Sitambu Siktata. Already all of you know the shloka. Okay, you can by heart this shloka also. Sitambu Sikta means wash with the cold water wherever it is affected. Okay, affected area should be washed with the cold water. Anulepana means we need to apply the Sita Dravyas like Chandana, Thagara, Kusta, Ushira, Venukapatra, etc. can be applied and it is going to produce the daha, okay, and peeling of the skin, etc. In the form of pana, we can give Kapitarasa or Gomutra. Okay, next question is, describe the Samanya and Vishesha Lakshana and its Chikitsa of Rushchika Visha. They can ask like this. Okay, you need to know this shloka. It's very important and it is compulsory to by head. Why? Because if you are written this shloka means they will give full marks. That is Rushchikasya Visham Tikshnam Adav Dahati Vannivat Urdhvam Arohati Kshipram Damshe Paschat Tu Tishtati Damshaha Sadyo Atirak Shavastuddate Sputati Vacha. Means what are the different lakshanas? You need to write it. This is the Samanya Lakshana. And Vishesha Lakshana means it may be Vata, Pitta, Kapha or Sannipataja or Madhya, Mrudu, Tikshna. Those things you need to write it along with Chikitsa. What kind of Chikitsa you are going to write it here? That is also very important. Okay. Next, describe about Vishakta Ahara Pariksha as per Ayurveda and contemporary view. Already all of you know that what are the Ayurvedic examination of Visha. It may be on the on the basis of Panchamahuta, Shabda Pariksha, Sparsha Pariksha, Rupa Pariksha, and Pariksha, Gandha Pariksha, etc. And as per Shushrutacharya, they have been clearly mentioned about Visha Pariksha on Pashu and Pakshi, and Visha Pariksha on Trivida Pariksha, like Darshana, Sparshana, Prashna. Or as per modern investigations, they clearly mention about Anumana or Aptopadesha, and qualitative and quantitative examinations means urine, blood, or TLC, or HPTLC, GC, that is gas chromatography, ultraviolet spectroscopy, etc. can be done to find out what kind of poison they have been consumed. By tests like if a person consumes any salicylate poisons, means in that you have a perichloride test, okay, or a tinder test, or dichromate test, etc. can be done in case of Visha Pariksha as per modern. I'll give a clear one examination. Marcuse test. Anyone knows where the Marcuse test can be done? In case of opium and its derivatives, to find out the opium and its derivatives, we are going to do the Marcuse test. Like that, there are various poisons are there to find out. Okay, next, same Dushi Vishari Agada, like a Bilwadi Agada, and write in detail about chemotherapy, radiation, induced toxicity. You need to know about all these things. In case of person is diagnosed with a cancer, they are going to take a treatment like chemotherapy, radiations, and immunotherapy, surgeries, etc. In such condition, there are some Visha Upadravas are there. In such conditions, what kind of Upadravas we are going to observe in that patient, and by which poison these Upadravas can be observed. For example, if a person is taking a chemotherapy treatment in case of cancer, that too cisplatin or doxorubicin, those drugs are going to cause nausea and vomiting or gastrointestinal irritation. Okay, in such conditions, what we need to give and what are the treatment we need to give, that must be known by us. For example, in case of Garopahata Pavakam, anyone knows this? Where Garopahata Pavaka is used? Wherever metabolic system is altered by these Visha Upatravas, in such conditions or due to cancers, we can use a Murvadi Agada. Like that, in case of alopecia, in case of peripheral neuropathy or liver and kidney toxicity, we can observe the toxic sign and symptoms. By radiation also, we can use observe various systemic toxic sign and symptoms. Coming to the last question or second question, that is describe about Dushita Vayu, Lakshana and Chikitsa. Already all of you know that Shushrutacharya in Kalpasthana 3rd chapter clearly mentioned about the different features of polluted air. Okay, and what are the different toxic signs and symptoms we are going to observe, and its chikitsa also. Kindly go through this PPT and you'll get to know that what kind of treatment is going to explain in this condition. And last question is describe the types of Madatya along with its chikitsa. Okay, what is Madatya? You must know. And what are the different types of Madatya? You must know. And what is the chikitsa for Madatya? That is also you must know. And write in that chronological order only. If they ask Madatya, means you should not write the Madhya Guna, Madhya definition like that. Okay. Coming to the MCQs. Part A questions, only MCQs. I'll give on 10 MCQs here. For example, according to Shushruta, Stavara Visha Adhishtanas are. How many Stavara Visha Adhishtanas are there? Anyone? Anyone wants to answer? You can put answer in YouTube also. Write in chat box. Only 10. Okay. As per Shushrutacharya, 10 Stavara Vishas are there. Okay. Dash dash is one of the ingredient of Dushi Vishari Agada. One is Mamsi. Second one is Amrita, Shonti, Trifala. Which one is answer here? Chatamamshi. Okay. Next is dash dash is the toxic principle present in the Vatsanaba. That is aconite. Okay. Next is Dash dash is protoplasmic poison. Phosphorus is the protoplasmic poison. Okay. Next, Visha Adhisthana in Vrishchika Visha, that is Ara. Okay. Which Panchakarma procedure is most beneficial in managing Madhyataya? Vamana is the best procedure. Okay. Next, which of the following yoga is used for treatment of Garopahata Pavakam? Anyone? Just now I explained this Agada. Anyone? Kindly put your answer in chat box also. Murvadi Agada. Okay. According to Rasatarangini, Upavishas are 9 in number. Like that, you need to prepare. Okay. Another 2 questions. The features of Gunja poison resembles with dash dash poisoning. Cobra snake, viper snake, kite snake, phosphorus or etc. It is similar to like viper snake bite. Okay. Anirdesha rasa is mentioned as one of the guna of Visha as per which acharya? It may be Charakacharya, Shushutacharya, Vagbhatacharya, Sharangadara. Right answer is Charakacharya. Okay. Coming to the summary, you need to attend or you need to write all the questions. All the questions are compulsory. It is in the form of LAQ, SAQ, MCQs. Okay. If you know best answers first means you can write first, then later you can write other questions also. Okay. And conclusion, kindly all of you maintain the time while writing the examination. And lastly, kindly all of you mark the attempted answers in the front page of the answer booklet. Any doubt, dear students? All the best for your examination. Thank you. Thank you for giving me opportunity to share my knowledge on this platform. Trishal?
Thank you, ma'am, for the very informative session. Now I request Dr. Manjula, ma'am, to take over so we can move to the second part of the session.
Good evening. Connect Is it audible?
Ma'am, the audio is echoing.
One more. Excuse me.
Yes, ma'am, it's audible now.
Okay. Can you share the slide? Hello.
Yes, ma'am.
Can you share my slide?
Um, have you shared it with the host, ma'am?
Yeah, I shared it.
Ma'am, can you try sharing your screen, ma'am? Hmm. Uh, Ma'am, can you only try sharing screen again, ma'am?
Hello.
Yes, ma'am, it's visible.
Hello? Hello?
Yes, ma'am.
Is it audible, ma'am?
Yes, ma'am. It's visible.
Okay. Sorry, once again, I'm sorry for the interruptions.
No,
So,
no, ma'am. It's okay.
uh, good evening, everyone. Madam has already presented most of the 65 marks has been covered. So, the remaining part itself is only 35 marks. 35 marks includes MCQ of 10 marks, SAQs of three questions, and LAQs of only one question from an forensic aspect. So if you have to remember more stress on than LAQs, you have to give importance for those aspects. As early Madam told that forensic aspects as well as Vaidya Sadruta and legal procedures. The whole topic includes 10 marks only. So there may be most of MCQs and Viva questions. When you go for personal identity, the long questions will be there and must know questions are must know topic it is. So you have to go through the whole topic like an identification data, age identifications, and its medical legal aspect. Any of the questions related to forensic, you must be think about the medical legal concepts. So Thantology is one of the topic where the LAQ is a common questions. So there regarding the death and signs of death and the medical legal autopsy and an exhumation. Exhumation like an SAQ or an MCQ question. Asphyxia is another important topic. So where you have to go through and hanging, strangulation and suffocation and drowning in has an important questions. So the next injury topic, those thanatology, asphyxia as well as injury carries 12 marks. So injury there, the thermal injury has given much importance. So mechanical injuries, fire and home injuries are desirable, no question. They there may not be any questions or long questions or an short questions. So there you can go with a nice no go any. For example, uh, there may be essay book questions like an differentiation between entry wound and an exit wound. So next is pregnancy, delivery, abortion, and sexual offences. This includes over 6 marks. So there again, medical termination of pregnancy is an important point. The battering and an infanticide, mostly they are an MCQ questions. So nice to know itself is related to the PCPNDT Act. Sexual offences, among that, the rape is an important questions. You have to remember how to examine and all. Forensic psychiatry, they again forensic psychiatry as well as a forensic laboratory laws, rules and regulations. The whole it carries about 7 marks. The MCQs are being common here. LFQs from a psychiatric uh, aspect. So SAQs from laws and acts and rules and regulations. So when you go for LAQs, these are the commonest questions which are being taken from Scientology, asphyxial deaths, and personal identity and injury. If you have less time, go through these all aspects other than being worried. So commonly LAQs and SAQs questions are being from these topics. So like Scientology, what they ask itself is define death, stages, modes of death, and then signs of post-mortem changes they have been asked. So there again you have to write an important points only rather than describing a lengthy answers. If it is flowchart, it is more easy to present and understand by an examiner. It easy to give the marks also. Asphyxial deaths. So there again, hanging, strangulation, and drowning is given a much importance. So there, the classification of hanging and cause of the death. Common is an asphyxia, but other based on the different concept like typical and atypical hanging, and what is a knot position and all. You have to describe while classification. So what is the base for classification? You have to mention there. So strangulation, when you define there further a classification when you are mentioning, there you have to mention what is ligature, ligature, meaning you have to write. And the postmortem changes as well as medical legal aspects. This it means, for example, strangulation is an most of an homicidal attack. So how it manifests. So one of the 2 points you must write there. Define drowning and its classification. We discuss later in. I took the question for an ideal question. So the injury and their classification of injuries and its medical legal aspects of injuries. So when it is common for injury, then you have to detail describes on what basis you are being classifying. For example, on legal basis, you classify into simple and grievous like that. On what basis the classification is being done. Examples are important. So when you just, if you name just as a classification, it doesn't mean gain good number of marks. So rather, you have to give some examples. So then how it happened and all. So thermal injuries, you have to be going thorough and describe well. That may be a long questions generally. If it is a burns for 5 months, rule of 9 and degrees of burns and postmortem changes and medical legal aspects should be described. When it is for personal identity, so how you are going to identify the age, like an ossification of bones, secondary sexual characters, general developments. So medical legal aspects of an age, like in criminal responsibility and all. In detail, you have to write. So, tattoos and occupational marks, they can be asked for SAQs, race and religions and sex determination. So how you differentiate, like in pseudo hermaphroditism or true hermaphroditism of the chromosomal abnormalities and nuclear sexing methods and different form of sex determinations. That and pelvic cavity differentiation. Like you must be very specific about the question for how much marks it is being asked and what you have to be present. So when you go for SAQs, it depends on the number of the points you have been presenting. Here, about 5 to 7 points you have to present based on the question what they have been asked. So define asphyxia. Commonly questions are define asphyxia, explain hanging in detail, or mechanical violent asphyxia in detail, or strangulation, suffocation in detail. Suffocation, until now they have not been asked much, but the smothering, such questions you have to remember for SAQs as well as an MCQs. Drowning. Then, so when it is personal identity topic, the dactylography is an important point where you have to mention how you have to identify or what are the advantages and disadvantages and medical legal aspects of dactylography. So abortion, when it is considered, it is an MTP, you must be remembering. So why the PCPNDT Act and what is the legal knowing the sex determination in an PCPNDT Act? So that should be mentioned here. So when it is sexual offences, most of the questions have been MCQs. There, the rape is a commonest question. So the examination of accused and victim and medical legal aspect should be written properly. A forensic psychiatry, so priority is not being given much importance, but you have to know the common signs and symptoms. So they get a good number of marks. And easy to present also. What is the significance of lucid interval like that? What is the criminal responsibility of mentally ill person? So what is the need of knowing the forensic psychiatry aspect and all? So forensic science laboratory, it is again desirable or nice to know questions from this aspect. Laws and action, these are points you must go once, then you can remember and easy to write them. Some of the MCQs for knowing simply. So an Indian magistrate inquest is done in all cases. So most of the MCQs are must-know questions are 15 and desirable questions are 3. Nice to know questions are 2. Overall, Agada Tantra concept. So here, nice to know questions are very minimal, so no need to much worried about. So you have to concentrate on must know as well as desirable know topics. So like Indian magistrate inquest is done in all cases except. So when you go with the magistrate inquest, we know that it is only conducted in police firing, dowry deaths, custodial death, and where the in murder cases, magistrate inquest is not being done, as you know. So in the second question, it is a lady died due to unnatural death within 7 years of her marriage. This is the hint what they are being giving here. So means if the marriage history is within 7 years, then it considered as a dowry death. So which is the option then? Anybody answers? Anybody want to answer? Is it the forensic expert or deputy superintendent or subdivisional magistrate or coroners to do the investigation? Okay, it is a subdivisional magistrate as it is comes under dowry death. The spiraling sign, it is seen in an IUD. Intrauterine death can be assessed based on sonographical studies where you see the spiraling sign. Punishments under the rape conditions under an IPC, and even if it is below the age, both the things you have to be known. So it is 376 IPC under 16 years. Kleptomania, this question from an forensic psychiatry. It is an irresistible desire to steal the things. So when a doctor issue the false certificates, like I said, some questions are being asked in an MCQs from an legal procedures and forensic part of. This is a few tricky questions may be answered, but intention here you have to go thorough the questions, then you answer. It's not been in hurry murry. Why? Because if you the person will know that who has been failed because of 1 marks, they know the importance of the 1 marks. So no need to be in hurry burry. So go through the questions peculiarly. A 19 years old female with a short stature. They are explaining the signs here. White shaped nipples, primary amenorrhea and all. What is the karyotyping? Like 45XO. Like that you have to remember the answer. Statement not true about the cadaveric spasm. If you know the cadaveric spasm well, these questions are not tough at all. It indicates the mode of death and it is appears instantaneously after death. All the muscles of the body are involved. Great force is required to overcome it. So when you call it as a cadaveric spasm, it's not all the muscles are involved in the whole the body muscles are not being involved. This you are knowing to theoretical topics so that it is easy to answer. Hydrocaution, it is one form of capital punishment. So how they are doing based on that the procedure. So drowning types are wet, near and dry drowning and immersion syndrome. It is just an immersion syndrome. So when you be thorough about the long questions topics, even in an SAQ or an LAQ or MCQ, it's not been a matter of difficulty. Fracture of hyoid bones. So when you know the definitions, what is manual strangulation, ligature strangulation, considered and all. So manual strangulations where the hyoid bone is being fractured. Antemortem bruise differentiated from the postmortem bruise. So this is what, is it the bruise occurred before death or it is occurred after the death? So then capillary rupture with an extravasation of the blood is a live reaction of the cell which we have been visualizing at the wound part. So that is a correct answer. Hesitation cuts. The word itself is suggesting what is hesitation. So that can be commonly seen in an suicidal wounds, suicidal attempt. Curving ulcers. So where the duodenum is to be show the burns. Most common cause of the death in thermal burns itself is hypovolemic shock. So coming to the model question answers. So I took from an asphyxia topic, that is define drowning or an hanging. You can, even an hanging questions can be asked. Explain its classification, postmortem changes, and medical legal aspects. So when a question is in divided, the marks distribution also be in a divided form. Like if you have written a complete definition, you'll get a good 2 marks. And then if you have explained the classification, 3 marks. It depends on your presentation and the question what they have been asked. So then postmortem changes itself is a peculiarity of the topic. So they may carry the 3 to 4 marks. So then medical legal aspect, 3 or 2 marks. So when you are writing the drawing, it must be very peculiar. It is a process of experiencing respiratory impairment from submersion or immersion in a liquid. In any liquid, it may be considered. So classification, is it typical or atypical? When atypical, you should write the another synonym. It indicates that you know thorough about the topic. So typical or wet, water is inhaled in the lungs. Means if you have taken long time to write these long questions, you have less time, then no need to form a sentence. You can write that water is inhaled into the lungs. Is a specific indication about a typical or a wet drawing. So like that, short points. If you have no time, then so you should not miss the marks. So for that purpose, freshwater drowning. So when it is freshwater drowning, how you to differentiate it is salt and freshwater drowning. So for that purpose, you have to mention the words like in myocardial hypoxia leads to ventricular fibrillation and leads to the heart failure and death. Salt water, where the salinity of water is being excess and causes the more concentration, leading to circulatory failure or shock and death. Atypical, and it's further classified into dry immersion syndrome, near drowning, and shallow water drowning. So as it is a long question, so you have to explain that. So dry water drowning is where the water is not entering into the lungs. Immersion syndrome, where it causes just by immersion, causes the fatal arrhythmias and leads to the death. So near drowning or secondary drowning, even after the drowning, if a person sustained after 24 hours of submersion, then there is, because of the complications like a pneumonia and sepsis, the person will lead to the death. Shallow water drowning, with the alcoholics or epileptics or infants may even fall in a shallow water pit. They may undergo with the drowning death. So any of the question, what is the cause of the death? You must to be mentioned. commonly the heading itself indicating what is the cause of the death. So this is an asphyxia, so you can mention it as an asphyxia. It's when you give a subheadings, then it is clear that you are knowing well about the topic. So try to make a subheadings and headings properly and points properly. So cause of the death, it is an asphyxia or it because of vagal inhibition or laryngeal spasm in case of immersion syndrome and all, confusion or the because of the fall in water, it may be because of head injuries and all, apoplexy, it is because of increase in intraocular pressure leading to the cerebral hemorrhages and all, or if a person sustains, then leads to secondary septic infections leading to the pneumonia or sudden bursting of aneurysms of the brain cell, so leading to the death. So commonly symptoms are recalling of past events. Means you have to mention the symptoms relevant to the topic. So if they have been available. So this is for asphyxia. You have to write few symptoms. If a person sustain, they may not go into the death. So these are the symptoms: mental confusion, auditory or visual hallucination, tinnitus, vertigo. A wet drowning shows the chest pain. What's the treatment aspect? For example, even thermal injuries also, you have to mention the treatment aspect. And here also you have to mention the treatment procedures, artificial respiration, or closed chest massage, or defibrillating under condition of an fibrillation act. So fatal period, in case of fresh water, 5 minutes, sea water, 8 to 12 minutes. So how you diagnose it is the drowning happened or not? Generally the froth from the mouth, gravels or a sand in an hand, which have been grasped because of a cadaveric spasm, voluminous of the lungs. The very specific is diatoms in a tissue is a diagnostic criteria. So postmortem changes, assurance external signs is a froth, cadaveric spasm. Probable external signs are anoxic changes, cyanosis and all. They are the common in any form of an asphyxia. Here, skin will become pale and wet. The presence of body in the water, goose skin, wasserman skin, postmortem any injuries. So then we have to differentiate based on the postmortem changes. Is it a suicidal or homicidal or accidental form of death? The medical legal aspect. So generally, if you are written only accidental and suicidal, it is less present in female form, where you have to mention them. Why you call it as an accident? Why you consider it as an accidental? So accidental is commonly seen in children's or in drug workers or intoxicated persons or epileptic subjects or precipitate labor in bath or lavender bath. So if they undergo the delivery in such conditions, there is a chances of accidental drowning. Causes of inability to swim or trauma or seizures disorders or heart diseases, exhaustion, alcohol, drug. No need to mention it, these all. Here you must remember them, a few of the other points. If you mention the points peculiarly why you consider it as an accidental form of one, then it is very clear to get a good number of marks. Suicide, where we see the suicidal in India, females have a common they undergo the suicidal drowning. So where here they may have a suicidal note or the clothes are wet and their clothes are very tightly packed. So they may have any terminal illness because of that they have been undergoing suicidal attempt and all. Homicidal drowning is not common. So where the small less age or an adult degenerative changes people may have an homicidal attack with drowning, infanticide in non-swimmers, or if they have been intoxicated, there is a chances of homicidal attack. This description should be mentioned in medical legal aspect. So the second question, uh, generally one question is from a medical forensic part. The second question, Thantology, related to the thantology. So definition again, the thantology definition, and they are very peculiarly mentioning. Describe the stages. So stages means how the death occurs. So that is firstly the somatic or systemic death occur. Later, the small cells or molecular or cellular cells undergo into the death. So that we have to mention, differentiating between the somatic or molecular death. The modes of death. So under the headings like coma, syncope, and asphyxia, we have to furtherly mention what are the reasons for coma. Like when you call it as coma, which part of the body means, and the loss of brain's function is considered as a coma. You have to mention it there. Causes like brain diseases or systemic diseases, like in diabetes mellitus or ketoacidosis, heart, heat stroke, eclampsia, opium group of poisoning and all. What are the post-mortem changes we see due to coma? It should be mentioned. Again, the separate points should be mentioned, like inflammation or hemorrhages, etc. Syncope. What is syncope? Again, you have to mention. It is failure of the heart functioning due to what causes the heart diseases, hemorrhage, or because of vagal inhibition, or poisoning due to diastasis or aconite. The postmortem changes. Here we can't see the peculiar changes, even if like a pale or empty cavity of the heart because of heart failures, asphyxia, failure of lung functioning, like an opium poisoning, which leads to paralysis of respiratory center, or carbon monoxide poisoning, or traumatic asphyxia. The changes is cyanosis or potential hemorrhages and congestion of the lungs. So SAQs define, classify the thermal injuries, describe the characteristics and degrees of burns, rule of 9, post-mortem changes, and medical. I took from the syllabus point, no need to worry about here. All the common, all 4 questions are not being in SAQs. Just for your understanding, these questions are being arising in the question paper. So I took all the topics from a syllabus point. So you have to mention when it is a forensic aspect, it's not due to heat the thermal injury occurs. You must be clarify that injury due to the application of either heat or a cold in any form to the external or the internal body surface. The classification is much important again. Due to cold, the general effects itself is hypothermia, local effects, chilblain, frostbite, trench foot. A one-line description should be written in front of the classification, subclassification. Due to heat, general effects, heat cramps, heat exhaustion, heat stroke, heat prostration, local effects, burns and scars. They may ask like differentiate between a burns and scar, maybe the 5 marks question, or they may ask like explain burns in detail, or they may ask the general effect of the heat with the treatment aspect. Generally, the chemical corrosive acids and corrosive alkalis questions will not be asked. Electrical current and radiations. Radiation burns like in X-rays and UV rays are the cause for thermal injuries. So when it is characteristic point of view to mention, then it must be clear like it's a dry lesion. Some specific points like in singeing of the hairs, burnt cloths. If a burn is an antemortem, it is what the carbonaceous material in an air passage. Vesicles, if so occur, they are not very peculiar, has thin scars and does not bleed, hard to touch. So these specific points you should mention. So the question is about types of burns. They're differentiating on depends on the degree. Is it on the depth of the burn? So epidermal. So we can call it as an even only the epidermal part. It we call it as a first degree burn. Dermoepidermal involvement is there, then a second degree. If it is the deep involvement of the burn, deep tissue has been burned, then you consider it as a third degree. This is how you have to mention clearly about the rule of 9. What to which of the parts you have been naming it as a 9%. Rule of 9. When you are writing the burns, you have to mention the rule of 9. So 9% of the 9 plus 9 of arms like that. So 1% of perineum. So what is the need of knowing the percentage of burns? You must mention that. So what happens because of a burns? Effects of burns. Scarring is less in scars than in the dry burns. Carbling ulcers, the gastric as well as duodenal mucosa. Like that. How we identify the age of burns? It is because of immediately redness. It is an early sign. So 2 to 3 hours vesication formation, 36 to 74 hours. Purulent inflammation, 1 to 2 weeks, sloughing will be occurring. After 2 weeks, granulation tissue formation, and result itself is a scar formation. Postmortem changes, external appearances, skin blackening, shortening of the muscles. Pulgistic attitude is very specific here. You have to mention it. You have less time to mention, so then pulgistic attitude and skin blackening should be written. So, presence of burnt material for the cloth and in cloth, the presence of smell of any petrol or diesel which have been used. Internal appearance, so congestion of the internal organs and doubling ulcers and heat fractures or heat hematoma. Very specific is to differentiate is shoot particles in an air passage. So why the death occurs in burn due to burns? So the primary shock due to fear or a pain, secondary shock due to hypovolemia, toxemia, septicemia, asphyxia, cyanide intoxication or fat embolism. Accidental is the most common, suicidal is occasional, homicidal it's don't sounds good has it is a burn aspect where the socially they may have a problem to do such activities. Concealment of crime is a common form. So when you call it as an antepartum burn, the vital reaction and soot particles are a very important points to be mentioned. The second question is differentiate between hanging and strangulation. So as here we have to understand the first the definition and how it happens, mechanism. Then it is easy to write any topics of differentiating factors. So there you have to make a 3 columns. So one is the future, that is signs of asphyxia is very less marked in hanging, whereas well marked in strangulation. The trunk protrusion and all is more marked in strangulation. Bleeding is less in hanging. Strangulation, it is more severe form of asphyxia. So these are more marked in a strangulation. So as in case of hanging, the neck has been hanged and because of that it is stretched and elongated. But where it is just a squeezing of a neck in strangulation, no such stretching or elongation. The very specific thing you have to mention here is ligature mark. So there, the different points you have to mention like direction. Hanging itself is oblique as the body has to be hanged, whereas strangulation, no need to suspend the body, so it's transverse. Continuity of the ligature mark, wherein hanging is non-continuous, strangulation is continuous. Level of the ligature mark in the neck is above the thyroid, whereas strangulation below the thyroid. The base of ligature mark is pale, hard, parchment-like, whereas strangulation is soft and reddish. Abrasions and ecchymose tissues will be less formed in hanging, whereas it is very common in case of strangulation. Presence of knot give us an idea about the homicidal attempt or suicidal attempt. and is it a hanging or strangulation? Usually singles, simple and slip knot will be there in case of hanging, whereas strangulation, multiple, so granny form and it is tied very force. Involuntary discharge of feces and urine is less common in hanging, but it is more common in a strangulation. Involuntary discharge of seminal fluid is more common in an hanging. Bruising of neck muscles is more common in strangulations. Subcutaneous tissues shows a whitish hard glistening, very specific to formation in hanging, whereas it is ecchymosed form. Carotid arteries are being damaged in maybe seen in intima, but whereas in strangulation it is rare. Signs of struggle is absent in hanging, as it is most form of suicidal and attempt, whereas here it is common in because of it is homicidal form of asphyxia. When you go for rape, so definition is very peculiar. One of the two definitions you have to write. It's an unlawful sexual intercourse by a man with a woman. Examination you have to write point wise. It is we need the prerequisite prior to do the examination. Requisition letter from authorized person, identification of the victim, two identification marks when you are prior to open the body, or a rape person itself, if a live written consent if a victim is above age of 18 and whether it is conscious or unconscious condition. So in presence of a witness, we have to do or take the consent as well. We have to do the examination. History is very specific, and the general examinations to know the vitals also is very specific. So examination of the cloths to knowing the any tearing of the cloths or stains of blood or in semen or anything else. You have to check for those aspects. So examination of the genitals and pubic hairs, and then mass of violence, blood stain, etc. Examination of venereal diseases. External genital injuries to be observed. That there is a tenderness, bite marks, abrasions, lacerations, or fractures. Other violences of evidences are to be observed. Genital examination should be done in lithotomy position. So there we have to collect the samples and like stains, blood stains and semen or spermatozoa, pubic hairs to be collected. So you have to remember the acronomy like tear, T for tears, E for ecchymosis, A for abrasions, and red for redness, S for swelling. This for remembrance. Just you have to mention each and individual point in front of that. What is the need or purpose of doing an examination should be mentioned. So if it carries 5 marks. So psychological symptoms should be mentioned. So because of the rape, it is underwent into the pregnancy, what the further procedure to be done, or if she had underwent into sexual transmission infections, then the treatment procedures. So no need to return in detail as it is 5 marks questions. To mention the points. Examination of an accused. So both the accused and victim examinations, they have to write minimal points. So section under section 53A or CFPC, the examining of accused to be done. Development of genital organs should be checked or physical build. Are they able to go for rape or not to be known based on the genital organ development and physical build. History and mental status of a person should be assessed, and the collection of a sample by scraping of blood and seminal stains and grouping and DNA hairs and name that is have to be checked. So means you have to mention the important points. What the punishment will be given. Whoever commits the rape shall be punished with imprisonment for 7 years, but which may be for life or 10 years or also with the fine. Under IPC section of 376A to D, custodial death if it happen, rape on a pregnant woman or children or gang rape happen, rigorous imprisonment with the fine will be the punishment. The next question will be common question is an MTP question. So common abortion or pregnancy and delivery. So they don't need to write in detail about classification and all. Here you have to concentrate on what is an abortion. When you are writing about Medical Legal Termination Act, you have to mention the year 1971. So on what termination of pregnancy is permitted for a broad range of conditions up to 20 weeks. So above that, it's difficulty to conduct a medical termination, and you must have proper reason and proper clause to have an MTP done. So like in therapeutic causes or an hygienic causes, on what grounds you are going to do the MTP should be mentioned. Hygienic causes or humanitarian causes or social causes or environmental causes. For what reason the MTP is to be going to conducted. So what are the procedures you are going to it? So this is common as methods like an abortifacient drugs are being given in case of criminal abortion and punishments if it is being done a criminal abortions. So section 312 IPC. So here if it is criminal abortion is a portion, then you have to go through this all points. Then PCPEDT itself is a separate question. Generally, it is asked for an MCQ form of it. So how we detect the what is the need presently to undergo is the scan and all. It is because of knowing the any abnormality, genetic disorders or metabolic disorders or chromosomal abnormality. Only we go with an MSC as a diagnostic test. Sex determination in India is not being done. So if you are doing only to notice these all deformities to detect. The next question is describe the symptoms commonly associated with the psychiatric disorders and significance of lucid interval. Uh, Forensic psychiatry, we go directly, deals with the application of psychiatry in administration of justice, or it's a branch of psychiatry science which deals with the study, diagnosis, treatment, and prevention of mental illness and behavioral disorders, which deals with application of psychiatry in administration of justice. If a person is mentally ill in such condition, if they have a need a justice of civil or criminal responsibilities, then the forensic psychiatry will help. So it's not just only for justice purpose, it is also for the treatment purpose and have a proper justice to those mentally sound, mentally ill person. Common symptoms here the delusions, hallucinations, illusions, impulse, or obsessions. So, forensic psychiatry increase the knowledge of the relationship between the mental illness and criminality. Well, evolution of a forensic legal operations in a criminal and civil developments in and system interactions, a deeper understanding and concern about the issues in biomedical ethics. Lucid interval is a time period during which the mentally unsound persons behaves very much like a normal person and all the signs and symptoms of insanity are completely absent. Um, medical importance, medical legal importance, the person is responsible for all his acts performed during this period, the person can give a valid evidence in a court of law. If a person is underwent with the because of any unnatural form of death, then the direct declaration is also being considered. The next question is identification of age and its medical legal aspect. So, on what basis we are identifying the age? So, there you have to mention the age or ossification center and all. So medical legal aspect. So there you have to mention the headings like criminal responsibilities and then judicial punishments, rape and kidnapping conditions, medical fitness or marriage contract, identification in very specific relating to the age aspects to consider them are they have done an rape or not, are they able to undergo with the punishments or not. So based on the age or skull examinations, if we have got only the skull. Then based on that, we can assess the age. Some of the MCQs, generally 10 MCQs for forensic aspects. So, like medical adequate, so where it is deals with the conventional laws of the courtesy between the members of the medical profession, IPC. So the most of the questions are some bit doubtful, like, so again you have to read it thoroughly. IPC means it is a code for the punishment. The when it is identification data, anthropometry is an outdated and scars is common. Handwriting is also, it can be manipulated. The most reliable method is dactylography. Rule of haze to assess the age of the infant. Rabidism is a woman with a woman sex. So false perception without any external stimulus is a hallucination. So such like questions like cherry red color postmortem staining will be seen in a carbon monoxide poisoning. 11-year-old girl rape victim is brought to casualty for medical examination. Then the medical officer is required to do the following things, except the word is except. You have to see thoroughly. So therefore, the consent to be taken from the patient. So as it is underage, she is unable to give the consent. So all the other options are correct. So it is the first option is a right answer here. All the steps for gamete in intra-fallopian transfer, as you have a point of artificial insemination and all. So there, the fertilization of the oocyte in a lab is considered as an except. It is an except form. Common is an ovulation stimulation. We do the oocyte retrieval. So transfer of the unfertilized egg into the fallopian tube are done. So practical questions, some of the practical questions. Hello. Some of the practical questions. So they give you that one injury photos or they kept an weapon. They will ask for and identify the weapon and criminal act caused by that. For example, knife, it causes the stab injuries or it causes the incise injuries. So you have to mention the criminal act that can be produced. It is a homicidal attack like form. What is the medical legal aspect? The very specific mass distribution is being given by CBDC curriculum. So it is very neatly, no need to worry about it, how long the syllabus is vast and all. They are very peculiarly mentioning the mass distribution. It's a smart work you have to do now. News items are being given, some paper cuttings are being given during your practicals. So where two specimens are being given, and they will give one case study like in paper cuttings to like a stab injury in Hubli cases. Like some articles cuttings are being given. There you have to identify the crime, how it happened, and what maybe the weapon is being used, and what the punishment should be given. And few like medical certificates, writing a medical certificates or a medical legal certificate, you have been given an option to write in a practicals. And viva questions, so it is trial, no need to worried about vivas. So there again they are very specifically mentioned. You can ask the questions from forensic from 10 marks and jurisprudence from 10 marks. So that they are also being given very specific marks distribution. I think I have completed my presentation. If any questions, you can ask. Don't worry about that. Yeah, the vast syllabus is there. Go through thoroughly about must know answers and prepare well for an exams. And don't neglect the forensic part also. Why? Because if you have written 65 marks of an Agada concept, you will get out of out. No, it's not like that. So most of any of the subject may be matter, must know questions should be given stress. So based on that, you can write the LAQs or SAQs or an MCQs. Hello?
Yes, ma'am.
Thank you for giving an opportunity and patience hearing. Thank you for the organization. It's a wonderful session and it's a very need of an hour for the students. As they have a vast syllabus, they need it's a burden for them to cover. So thank you for the opportunity and thank you once again for
Thank you,
giving me.
ma'am. Thank you. We now come to the end of the session. I thank the Almighty for the success of today's session. I take this opportunity to thank Dr. Anjana ma'am and Dr. Manjula ma'am for taking time off their busy schedule to present such a meaningful session. We have learned a lot through your vast experiences, ma'am. I thank the Jignasa team for arranging this useful session. I thank the participants for showing interest and joining the session. Once again, I thank one and all.
Thank you.
Shall we end the meeting?